Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you the top 10 tips for people with COPD, Chronic Obstructive Pulmonary Disease. Tip number 1, stop smoking. Smoking is the number one cause of COPD, and if you continue to smoke after you've been diagnosed with COPD, your COPD will get worse. So the most important thing you can do to prevent COPD or to make the disease to improve your symptoms while you have COPD and not get sicker is to stop smoking. Tip number 2, exercise for at least 30 minutes a day every day. Exercising is an important component of living with COPD. If you exercise for 30 minutes a day, and this includes just walking, then you will improve your symptoms from COPD. If 30 minutes seems too much, then start with 5 minutes and build up to 30 minutes. But the goal is to walk 30 minutes a day, every day, or do some other kind of activity where you can increase your heart rate and condition your lungs to be able to breathe easier. Tip number 3, good nutrition. Many people with COPD are not able to eat enough because of their shortness of breath and fatigue. Not eating can lead to malnutrition and can make the symptoms of COPD worse and increase your likelihood of getting an infection. So to increase the number of calories that you eat small and frequent meals with nutrient-dense food, for example, eggs, and eat meals that require little preparation, like microwavable foods. Rest before meals, take a daily multivitamin, try nutritional supplements like bars and shakes, which are also a good source of extra calories because they're easy to eat and require no preparation. Tip number 4, use a short-acting inhaler or nebulizer. The best short-acting medication for COPD is a combination of 2 drugs called albuterol and ipratropium. The brand names for these drugs are Combivent if you're using an inhaler, or Duoneb if you're using a nebulizer. These medications are meant to be used when you're having an attack of COPD, and they give you quick relief. Tip number 5, use your long-acting medications every day. Now, this is different from the short-acting medications, which you only need to use if you're short of breath. The long-acting medications over the long term will prevent you from getting short of breath and will preserve your lung function. So it's important to take long-acting medications even when you're not having symptoms, even when you're feeling great. So your long-acting medication, the best long-acting medication for COPD is called tiotropium. The brand name for this is Spiriva or Handihaler. The second best long-acting medication is a combined long-acting beta antagonist, a combined long-acting beta agonist and inhaled corticosteroid. The 2 drugs are called fluticasone and salmeterol. The brand name is Advair. And Advair can be added to Spiriva or Handihaler if Handihaler and Spiriva are not controlling your symptoms. So the long-acting medications, once again, the number 1 is tiotropium, and that's called Spiriva or Handihaler. And then in addition to that, you may be prescribed a long-acting beta agonist and corticosteroid, specifically fluticasone and salmeterol, name brand Advair. So tip number 6 is use your inhaler correctly. Breathe out slowly and completely. Place the mouthpiece between your front teeth and seal your lips around it. Breathe in through the mouth quickly and deeply over 2 to 3 seconds as you dispense the medication. Remove the inhaler from your mouth and hold your breath as long as possible, ideally 4 to 10 seconds, and then breathe out slowly. Tip number 7, ask your doctor if you are eligible for a referral for pulmonary rehabilitation. People with more severe COPD qualify for pulmonary rehabilitation. These are programs that include education, exercise training, social support, and instruction on breathing techniques. And all of these things combined can improve your COPD and make you feel better. Tip number 8, home oxygen. Home oxygen actually extends your life and makes you feel better if you're in a certain class of COPD. So if your doctor prescribes home oxygen, it's important that you take it. And furthermore, it's important that you take it for the number of hours each day that's prescribed. The benefit of oxygen is based on the number of total hours you use it each day, and it's important to use it according to the way it's prescribed and not less. Tip number 9, if you have COPD, get the influenza vaccine, the flu vaccine, every year, and get the pneumococcal vaccine once before age 65 and once when you turn age 65. And tip number 10, believe in yourself. COPD is a completely manageable illness. There are many things you can do to improve your quality of life and make you feel better. So I recommend you work with your doctor and tackle this challenge of living with COPD. You can do it. Thank you for listening, and take care.